Which of the following patients is most in need of a rapid trauma assessment? A. A middle-aged man who has fallen from a height of 5 feet. B. A teenage boy who is unconscious, but who has no obvious injuries. C. An elderly man who is conscious, but who is also complaining of severe chest pain. D. A young woman with a gunshot wound to the chest. What is the most critical requirement that must be fulfilled for an EMT to assist a patient with angina who wants to take their nitroglycerin? A. The nitroglycerin must be administered sublingually. B. The patient must be experiencing severe chest pain. C. The patient's systolic blood pressure must be above 100 millimeters of mercury. D. The EMT must have medical control. Which of the following describes how a child with a mild airway blockage should be treated? A. Try to relieve the airway obstruction. B. Do a finger sweep. C. Immediately provide transportation to the hospital and do not agitate the child. D. Apply abdominal thrusts and back blows. On each call, each squad should make a minimum number of contacts with dispatch. Which number is this? A. 7. B. 6. C. 5. D. 4. Which of the following is not regarded as one of the signs and symptoms of the patient? A. Obstetrical conditions. B. The patient's last oral intake. C. Behavioral issues. D. Environmental emergencies. What flow rate ought a nasal cannula to have? A. 4 to 6 lpm. B. 3 to 6 lpm. C. 1 to 4 lpm. D. 1 to 6 lpm. In treating a patient, which of the following should you do first? A. Determine the patient's signs and symptoms. B. Ask about the patient's pertinent medical history. C. Find out what medications the patient is taking. D. Determine if the patient has any allergies. You are assessing a stroke patient to see if advanced therapy would be successful. What is the critical factor you need to determine? A. Monitor vital signs. B. Administer oxygen. C. Attempt to diagnose the cause of the problem. D. Clear the patient's airway. Which of the following does not make up the upper airway? A. the pharynx. B. The oropharynx. C. The carina. D. The nasopharynx. Which of the following does not make up the upper airway? A. The pharynx. B. The oropharynx. C. The carina. D. The nasopharynx. A diabetic patient who is conscious but quite disoriented is being evaluated by you. You are unable to identify if the problem is hypoglycemia or hyperglycemia. What do you do? A. Administer oral glucose. B. Monitor the patient for changes. C. Administer 4-dextrose. D. Immediately transport the patient to the nearest medical facility. What signs should you check to see if it's okay to enter a scene? A. Traffic from civilians, law enforcement, or other rescue personnel. B. Hazardous substances or dangers like downed electrical lines, broken glass, etc. C. Environmental problems, such as unstable terrain, heat, or lack of light. D. All of the above. How much oxygen can a bag valve mask provide? A. 95%. B. 100%. C. 90%. D. 80%. What is the third step in the initial assessment process? A. Assess the patient's circulation. B. Identify the patient's chief complaints or any life-threatening conditions. C. Assess the patient's airway and breathing. D. Determine the patient's level of consciousness. What is the first step to take when you start to size up a scene? A. Determine the mechanism of injury. B. Do a body substance isolation. C. Determine the safety of the scene. D. Find out how many patients you need to treat. You are evaluating a patient who is breathing, but only very slowly. What's the correct name for this type of breathing? A. Dyspnea. B. Tachypnea. C. Bradynia. D. Apnea. Which kind of suspension system for a helmet is best? A. 4 point, B. 6 point, C. 2 point, D. 8 point. Who has the expertise and power to step in during risky rescue situations? A. Sector Commander, B. Safety Officer, C. Staging Officer, D. Staging Officer. When should a chemical spill be handled when a rescue effort is required? A. At the same time as the rescue, B. Before the rescue, C. After the rescue, D. Do not deal with the spill. Which type of rescue has the highest death rate? A. Hazmat, B. Swiftwater, C. Confined space, D. Vertical. What must occur before the rescue operations access phase starts? A. Notify family members of the plan. B. Call in to dispatch the plan. C. Review written protocols. D. Briefing on the plan with all rescuers. Paramedics test. Whether it is treating the victim of a car accident or interpreting the EKG of a heart attack patient, paramedics must remain composed on every call. They must also assess each situation and come up with the best treatment option. The NREMD exam for paramedics consists of a cognitive test and a psychomotor test. The written exam includes 70 to 120 questions. It is important to remember that 10 of these questions are called pilot questions and will not affect your score. Paramedics in the community are an integral part of a health system that is struggling to meet increasing demand. They can provide a comprehensive range of services to patients in their own homes, which can decrease the need for emergency department visits and other ambulatory care. They can also help manage long-term conditions and prevent hospital readmissions. They can provide health assessments, chronic disease monitoring and education, immunizations and vaccinations, laboratory specimen collection, medication compliance monitoring, hospital discharge follow-up and minor medical procedures.